Okay, so we have the desiccator, we have the AI, we have, oh gosh, what was the other thing that I'm so excited about? Curadon. What else are you looking at that you know you're going to be training teams on in
Mm-hmm.
24? Okay, so we have the desiccator, we have the AI, we have, oh gosh, what was the other thing that I'm so excited about? Curadon. What else are you looking at that you know you're going to be training teams on in
Mm-hmm.
24?
Well, we have always been a big proponent of hygienists utilizing their ultrasonics to the maximum capacity. And to my knowledge, current research shows that the Magneto ultrasonics and the piezo ultrasonics are just as effective, as one is as effective as the other. And I'll explain that in just a second.
Okay.
And then also that those are just as effective as hand instrumentation. So if it's just as effective, why would we not use a powered instrument versus, our hand? And certainly there are going to be a percentage of scaling that the hygienist feels most confident doing by hand. But in our experience and my personal clinical experience and based on research as well, the vast majority of the scaling can be done using ultrasonics. Now,
Okay.
Magneto and piezo are the two different types of technology. And when I say technology, that's a category, not necessarily a brand.
Okay.
And the piezo tips are tiny little metal tips, typically stainless steel, that fit into a handle. And there's a unit involved that creates energy that moves that tip that then disrupts the biofilm and the bacteria and the tartar, the hard tartar. The Magneto is a long insert that has metal stacks on the end of it. So if you see something like that laying around and it has the scalar tip on the end, it does the same thing. It just works in a different way. So the technology is just the engineering is slightly different on that. One of the new innovations, and I have to give a shout out to my good friend Noelle Paschke. She and her husband Rich are ultrasonic engineers, and they have worked on lots of different ultrasonic technology and dentistry for decades. And so one of their products is just being released just at the end of 2023 through Parkel. It's called Dura Tip. And so one of the things with Inspired Hygiene that we look at every time we go in and work with a client is the quality of their instruments. And it's interesting, Teresa, this is kind of a squirrel moment, but I think it's relevant, is it's really common for us to walk in and notice that the hygienists are using instruments that are very worn, whether it's hand instruments or it's ultrasonics, and either they don't know that they're as worn as they are, or they do know that, but they don't feel like they can get new instruments for whatever reason. But here's the interesting part is then when we approach the practice administrator and or the doctor owner and we say, hey, hygiene really needs some new instruments, and we took a look at it and they're just very worn. They're always, I don't remember one time over 20 years that they said, well, too bad. Like they just need to use worn out instruments. That never happens, right?
No.
They say, well, gosh, we want them to have the instruments that they need to do a good job. And we're typically there, helping them elevate their periodontal diagnosis and treatment. So they're going to be using these instruments more. And they need to be able to do a very thorough, clinically effective job. And if you have worn out instruments, it's just like if a dentist were using a dull burr, right? They're not going to get the best prep. What happens is, though, they say, here's the deal. We want them to have their instruments, whatever they need, but can we space this out over time? And our answer is absolutely. So what I think probably happens is somewhere down the line, somebody said something like, hey, we need to put a pause on ordering any equipment that we don't absolutely need to have. And then 2 years goes by and the hygiene team still feels like they can't ask for, new instruments or equipment. So that's not unusual. And it's just sometimes a communication breakdown. And then we can go in as a third party and kind of uncover some of those things and resolve that. So that's kind of the background of that. But the beauty of this new instrument is that all instruments wear, right? It's just,
for sure.
It's just a matter of friction and use. Right? And some of that metal is just going to wear away. But a lot of times the clinicians are not aware how worn it is, and they feel like they need to turn it up so that it works effectively, and that creates sensitivity for patients, and then it's this whole snowball effect. And so this particular tip is extremely durable, and even when it loses 1 to 2 millimeters of the metal, it works just as effectively as a new tip.
Oh,
so
good. Okay.
so it's going to be a longer term investment, something that's going to last longer, I should say, and having consistent performance, rather than a gradual expected decline of performance in a traditional tip design.
Would you like to hear more? Follow the link for the full episode.